Today, we're diving into something really hopeful in the world of dementia care. And you know what? It doesn't come from a pill or a high-tech lab. It comes from something much, much more human. A simple conversation.
I mean, just think about that for a second. What if a conversation could actually change the experience of living with dementia? We tend to focus so much on memory, on the cognitive stuff. But what about the emotional journey? That's what we're going to unpack today. So, to really get why this new research is such a big deal, we have to start with a part of dementia that often gets overlooked. It's this hidden struggle that's happening right alongside the memory loss.
And here it is. It's like a double burden. Can you imagine? You're already coping with all the challenges that come with cognitive decline, and on top of that, you're also fighting the heavy weight of depression or that constant, buzzing feeling of anxiety. It's a huge mental health toll, and it desperately needs a good treatment.
Okay, but here's where the good news comes in. There's now some really solid evidence for a powerful tool. A groundbreaking study out of University College London is pointing to a new way forward, and honestly, the results are just wow.
And listen, this wasn't some tiny little study. We're talking about researchers digging into data from over 1,500 people with dementia. These were folks who took part in a program that offered psychological therapies, and the findings were so significant they were published in the journal eClinical Medicine.
Just look at this number, 63%. That's how many people saw a real measurable improvement in their depression or anxiety. That's not just a statistic. That's a massive, life-changing impact for so many individuals and their families.
And it gets even more incredible. A full 40%. That's 4 out of every 10 people in the study. Got so much better that by the end of their treatment, they didn't even meet the clinical diagnosis for depression or anxiety anymore. Think about that. They essentially recovered.
So all of this sounds amazing, right? But it probably leaves you wondering, what exactly is talk therapy? We hear that term thrown around a lot, so let's just quickly break down what we're actually talking about here.
Really, at its heart, it's this: having a dedicated time and space to talk things through with a trained professional. It's a process, a way to explore your thoughts and feelings so you can understand them and, work through them. It's not just random chatting, it's a guided, therapeutic conversation.
And the things it can help with? The list is long. This study focused on anxiety and depression, but things like cognitive behavioral therapy, or CBT, are used for so many different challenges. And what's really key here is that therapists can adapt their approach for someone with dementia, focusing less on dredging up old memories and more on solving problems in the here and now.
And why does it actually work? Well, the science behind it is pretty cool. It turns out that the simple act of saying what you're thinking and feeling out loud, actually putting words to it, can literally lessen the power of those feelings. It helps get the pain and sadness outside of you, which makes it feel so much more manageable.
Now, the real power of this study, I think, becomes crystal clear when you put it next to the other common treatments. Having a non-drug option that actually works, that's a total game changer for dementia care. The study's lead author, Georgia Bell, said it best. She pointed out that the evidence for using medication for anxiety and depression in people with dementia, it's just not that strong. And let's be real, a lot of people would just rather try talking therapy before jumping to medication anyway.
And here's the other really important piece of the puzzle, this time from the Alzheimer's Association. Medications can come with a whole host of problems. We're talking side effects that can make thinking even harder, or bad interactions with other medicines a person might be taking.
So when you lay it all out, the choice becomes pretty stark. On one side, you have talk therapy. It has basically no side effects, it empowers the person, and you don't have to worry about drug interactions. On the other side, medication, with all those potential risks. For this group of people, the safer, more empowering option is just so obvious.
Okay, so this is all incredibly hopeful stuff. But the big question is, how do you actually make it happen? How do you find the right support? Well, there are some really clear, practical steps you can take.
A great place to start is with the doctors you already know and trust. Your family doctor or a neurology clinic can be fantastic for referrals. After that, organizations like the Alzheimer's Association are packed with local resources. And of course, there are online tools that can help you find qualified therapists in your area. And when you're looking for someone, just keep a few things in mind. Do the basics, check their license, see if they take your insurance, but also ask what they specialize in and see if they offer things like teletherapy, which can be a huge help. But maybe the most important thing to remember is this: it is totally okay if the first person isn't the right fit. The connection is everything. So if we boil all this down, the main takeaway is actually pretty simple, but it's also incredibly profound. We now have really strong evidence that talk therapy isn't just some nice, fluffy add-on. It's a real, effective, evidence-based tool that can seriously improve the quality of life for people living with dementia. Which leaves us with one final, big question to think about. For so long, the focus in dementia care has been almost entirely on cognition and memory. But what if caring for a person's emotional well-being is every bit as critical? Maybe, just maybe, this is the next great frontier in how we care for people with dementia.